So next child, 1 year, 3 months, fever of 2 days, rhinorrhea, excessive crying for 4 hours. And you know it is a acute otitis media. How should I evaluate? So you should have a otoscope in your clinic. You should have a pneumatic otoscope if possible, and you try to look at the tympanic membrane, the mobility, the position, the color, and the opacity and the landmarks. So if you look at these things, you know the one in the left ear is the congested, and you have the acute otitis media. And we have to stratify otitis media into severe or non-severe. And severe means unresponsive pain. You're given some paracetamol, still the pain is there. Child is toxic and child has high fever. Whereas non-severe, he has some intermittent pain and there is a response to the analgesics and there is mild or no fever. So management, again, some saline nasal or paracetamol, but the antibiotic. It is a huge congested slide, but the child with the less than 6 months, if you look at, if you get a case, it should be started with the IV antibiotics, either ampigenta or ceftriaxone. But an older child, 6 months to 2 years, you need to give amoxicillin. But it is more severe case, you have to start with Co-amoxiclav, around 45 to 50 milligram per kg. And mind you, the duration should be at least 10 days. That part you should never forget. You should educate the parent that it should be taken for the entire duration of 10 days. And if the resistant OM, that is, if there is no response even after 48 hours, if you started amoxicillin, switch over to Co-amoxiclav again for 10 days. So similarly, there are other age group wise, but amoxi or amoxiclav becomes the first drug of choice. Even if you look at the national treatment guidelines of the government of India 2016, and that also recommends amoxiclav as the first choice, amoxicillin or amoxiclav as the first choice for treatment of these things. So this is algorithm for treatment of AOM. With the severe symptoms, treat with the antibiotics, follow up on 10th day. When there is no severe symptoms, if look at the age of the child, less than 2 years, bilateral, antibiotic use, and unilateral, observe and treat with the antibiotics if it worsens. And deterioration, if you observe deterioration, give antibiotic. In a child more than 2 years, follow 48 to 72 hours. If the symptoms persist, you treat with the antibiotic. So we need to use the antibiotic judiciously, have a pneumatic otoscope.